Like the six-pack I'm talking about.
Correct.
So it
So those
expands.
muscles are like this in youth, and as we have babies, and of course with age, they tend to stretch and separate. And what we're doing in the midline is to suture those muscles, actually the fascia.
So you bring them back together.
We bring them back together again, and we can bring them back with different degrees of tightness also.
But it doesn't happen to every woman. Why is that?
Boy,
I guess that's a big question.
I wish
but it
we
doesn't
knew
happen
specifically. But I have seen patients that we're seeing them for other things. For instance, the breast situation, where their tummies look pretty darn good, even after 2-3 babies. So, fortunately, it's not.
So with this
doesn't
woman,
happen to everybody.
This woman's not a liposuction candidate.
Well, she could have had liposuction, but if she did, she would have still had that sagginess to her abdomen. She would have still had the hooding and the stretch marks, the hooding around the belly button. Okay. So, yeah, she would have been helped with liposuction, but I don't think that she would have been happy. And that's the reason why, when you go see somebody, a physician to evaluate, to have that consultation, it has to be more than just a liposuction doctor. The doctor has to be able to handle all sorts of situations.
To do both the tummy tuck.
Correctly, yes.
And to get a good evaluation. Okay, so with her, what did you do?
So with her, we did that Avalar abdominoplasty, where we were able to liposuction, contouring the fat, then we were able to mobilize and tighten the skin and remove the excess skin, rebuild her belly button, and also produce a very, very defined sculpture appearance to the abdomen, as you can see, and also the scars.
Like a fitness person.
Well, like somebody who's been working out for years. Now, she is a good patient, and she does go and work out, but we just enhanced greatly what she was able to do on her own.
Does this give them leverage to start work? I mean, do you see that they start eating better, exercising more when they get these procedures?
Sometimes it's almost like a new person who comes in. They're taking care of themselves better. They have new hairdos. They're wearing clothes that they never thought they could wear. And of course, their personality is much more jovial and ebullient.
Really?
So, it makes my heart very gladdened to see those type of changes.
Big boost in self-esteem. Okay, we're going to take a quick break. We're going to move, I guess, to other tummy tuck photos and also breast lifting. Also, you brought some breast implants. A lot has changed there.
Correct.
Is that right? Okay. Mm-hmm. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing mommy makeovers. Are you a candidate? We'll be right back. You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. What can be done and how to get your body back with triple board certified cosmetic surgeon, Dr. Maurice Sherman. Okay, Dr. Sherman, you have a lot more photos.
Yeah, I don't know whether we have time to look at all of them, but
all right.
But here's another typical example of what we see: a relatively young lady who's in relatively good shape, but has had several children, and she is left with this bulging, saggy lower abdomen.
A lot of stretch marks here.
And a lot of stretch marks, yeah. And if you would feel her tummy, she probably has some separation of those muscles in the midline that prevents that abdomen, no matter how much she works out, from getting real tight and firm.
Are there any statistics on how many women after pregnancy, get this stretch mark look? I mean, is it 1 out of 5, 1 out of 10?
Well, unfortunately, I think it's definitely at least 50%. I would say somewhere about 60 to 70%. So one could say that pregnancy is not really great for a woman's body.
Mommy makeover, we're talking about after pregnancy, breast lifting or augmentation.
Correct.
Or maybe even a redo of their breast. Tummy tuck lipo. Correct. With this new technique. Okay, so with this woman, what did you do?
Well, again, with this lady, we were able to tighten up the tummy, correct her muscles, eliminate that saggy, stretched skin, because it's never going to come back. Hide the incisions very, very low in the abdomen so that she can wear.
That's a perfectly flat stomach, by the way.
And give her a flat, tight stomach like she's been working out, or at least it'll stimulate her to continue to work out and to remain healthy for the rest of her life. Okay, Randy, what we have is another mommy makeover, and again, we see that the fact that her tummy has somewhat ballooned out, and no amount of exercise is going to get that back. And in fact, in clothes, again, she has that predominance there that really bothers her. So with the type of techniques we discussed, we were able to give her a flat tummy. And then if we look at the breast, you can see that she was developing some fatty fullness in the breast that, in other words, she felt she was too big and too heavy in the breast tissue. So we're able to do a lift and reduce at the same time some of her fullness. And we're able to bring her back to a more proportional look to her entire body. so that everything now looks fit together and her clothes look great on her. Okay, so here again is some more breast that we normally see after several pregnancies, and this is a deflated breast that what we were able to do is to just augment that breast and get her back to where she was, not making her bigger, but just back to where she was before she became a mommy. The other patient is a patient who comes in after several pregnancies and after breastfeeding, and she has a lot of drooping to the breast. She hasn't really lost, she's a young lady, so she hasn't lost that much tissue, but she's droopy. And for that, we were able to do a lift procedure.
And these are minimal incisions. I mean, you don't really see the incisions, but you go through the nipple area. Is that right?
We go through, when possible, we like to hide the incisions around the nipple area. We can also hide them in the inframammary crease or fold, which is underneath the breast when we can. But sometimes in the lifting area, we have to do some further incisions, but almost all of them will continue to look better with time. And, you know, I've been told that these type of incisions look a lot better than a big, saggy, droopy breast.
Now, the implants, you brought implants, and we're just about out of time. What's changed there?
Well, we have, of course, the old saline implants, which didn't have a great feel to them, but which was the only thing that we had available. And in the last couple of years, since November of '06, we have now approved and completely safe and effective these silicone gel implants. And you can feel that the feel is a very fleshy, normal feel. And most of our patients now prefer those type of implants. We have different sizes. They're so-called high profile, medium, low profile to fit the individual patient, and even the newer implants, the gummy bear implants, which
hey, what is this? You get a lot of questions about these gummy bear implants, you say?
Well, we do. They're called form stable implants, which means that you can't compress them. One of the advantages is that the fact that you can use them on top of the muscle, and they're also good in revision cases. But one of the disadvantages is that you have to use a much, much bigger incision to get them in.
Okay, now after pregnancy, what's the number one fear? A patient needs a breast lift. What's their number one fear? Is it the incisions, the scarring?
Oh, I think if they need a lift, they're concerned about the incisions, because in the past, the only incisions available was what we call an inverted T or Weiss incision, anchor incision, and that left a lot of visible scarring. And now there are lots of different techniques where we can avoid that. There are better ways to even treat the incision so that the scars, if you will, heal much, much better and much less offensively. In fact, look very, very good to the point where you can't even see them.
So there's a lot of technique. I mean, where do you go to learn? Maybe this is an obvious question, but what do you do to learn, and how have incisions with lifting changed in the last 5-10 years? Have they?
Well, absolutely new techniques have come about, new ways to manipulate the breast tissue, and you pick these up by several ways. You go to meetings. You read about them in peer-reviewed journals, professional journals. You go to workshops, and then you go actually and spend time with some doctors who are actually doing the surgery. So it's not like you're starting from scratch. You're learning a new technique, but you already have that wisdom about how to treat and how to manipulate.
So the lift,
tissues.
By the way, is the trickiest or most technically demanding of all the breast procedures. Is that correct?
I would say so, yes. Mm-hmm. Okay. And that's because, of course, you need to know how much you're going to lift, and you need to want to get both breasts symmetrical.
Would you stack your incisions up against anybody out there?
Well, I think so. I think we have some very happy patients, and we take care to make sure that those patients stay happy by treating those incisions appropriately so that they're going to look good.
But with incisions in general, do you like to go always through the nipple area? What about the armpit? I'd like to know your thoughts there. Belly button, under the fold.
Well, let's talk about the belly button. There is a belly button approach, but you have to use saline implants. You can't use silicone because you have to put them in deflated.
Interesting.
Through a small little tube. And again, that omits the preference of using silicone gels.
You know, I should mention, I've had a few people approach me for interviews on the belly button technique. And I asked the doctor, I said, why, very well-known person here in San Diego, I said, why the belly button? They go, it's a great niche. Nobody else is doing it. And to me, I thought, that's the wrong answer. You know, it should have been, because that's where you get the best results, right?
Right. Mm-hmm.
So, I mean, what are your thoughts? I mean,
well, my thoughts are that since most of my patients want the the silicones, and we can't offer that approach. But I certainly have been trained, and we have the equipment to do the belly button approach, but we have to use a saline implant. And the only problem with that approach is that it's what's called a closed pocket development. We're not sure where, we can't actually see where that
So it's not great for
going.
what, cleavage?
So, well, it may not be good for somebody certainly who has some drooping to begin with, because those are the patients that are going to need to be either under the muscle, the pocket opened a little bit, or the inframammary crease lowered appropriately, or perhaps even lifted. And then if you're going to make an incision to lift the breast, then why go through the belly button? Go through that same incision. So we're only dealing with one incision and not two.
Okay, so with women, and we're just about out of time, after pregnancy, drooping, they have stretch marks, go in for an evaluation.
Correct. Go into evaluation. Know everything that you can do. You don't have to do everything, but let the doctor evaluate you. And hopefully, of course, if you do come to us, we'll explain to you all your different options, what all of them mean, cost factors, obviously, recuperation time, and of course, expected results.
Now, 50 is very young today, but is that old for this kind of a procedure? To have a tummy tuck, breast augmentation, or lift altogether?
Absolutely not. You know, we're using the best and the latest type of anesthesia, and some of this can be done under local also. Some of the liposuction operations. But the point is, we're using all the safest techniques. We get our patients mobilized very rapidly, and our complication rates have been continuing to decrease over the last several years.
Okay, tummy tuck, lipo, and breast augmentation, but you're also doing this special water jet lipo. Tell me what that is. Am I saying it right?
You are. It's called the body jet or the water jet.
Okay.
Or it's also referred to as water-assisted liposuction. And if you think of it, we're washing away the fat. But what we're doing with this new technique is in a very, very less traumatic technique. In other words, we're gently removing that fat away so that these patients have hardly any bruising, minimal swelling, and they feel great the next day. Number one. Number two is we're able to harvest that fat in a much, much more viable technique. And that's important because now we're starting to use that fat, re-injecting it into the buttock for buttock lifts, into the breast for that fullness in the upper part.
So you're injecting fat for breast now. Is that right?
In selected patients, we certainly are, and we're starting to see some excellent results without having to go through a formal operation with an implant.
All right, I want to thank you. Very interesting stuff. They could go to your website, find out more information. I want to thank you for coming on the show. Always a pleasure. Good stuff.
Okay,
Mommy
Randy.
Makeovers.